All right, today we're going to talk about chronic kidney disease. Next slide. To talk about chronic kidney disease, we're going to follow the story of Jeff. Jeff is a 50-year-old man with a history of diabetes and high blood pressure. Jeff has also smoked on and off for most of his life. Unfortunately, Jeff does not consistently follow the recommendations made by his doctor or the medications that they prescribe to control these issues. So one year, Jeff goes to his doctor and they start discussing with him about better controlling his diabetes and hypertension to prevent issues with his kidneys. Jeff also needs to stop smoking. Uh, a couple years later, Jeff goes back to his doctor. His GFR has reduced. Jeff is diagnosed with chronic kidney disease. Again, Jeff's doctors try to reinforce that Jeff needs to follow the recommendations and take his medications. A couple years later, um, Jeff's GFR is reduced again. Jeff's doctors really stress the need for Jeff to consistently take his medications and follow their diet recommendations. Unfortunately, after this time, the Jeff has a medical incident where he is rushed to the hospital for trouble breathing, back pain, peripheral swelling, and congestion. While he is in the hospital, Jeff sees a nephrologist who informs him his GFR has reduced again and that he has now he has severe renal damage. Um, as this continues, Jeff's GFR drops again, and now Jeff is in complete renal failure and has to remain on dialysis for the rest of his life.
As for the preventative measures that Jeff could have taken, it is said that patients with kidney damage should limit the intake of certain foods to reduce the accumulation of unexerted metabolic products, but also to protect against hypertension and other heart and bone health problems. Some examples are sugars, red meat, and sodium, which are associated with increasing the negative effects of kidney disease. Healthy diets include high intake of vegetables, fruits, nuts, whole grains, and fish was associated with lower rates of death in individuals with CKD. A plant-based diet was shown to influence survival through its impact on metabolic acidosis and blood pressure. Renal-friendly diets also help by managing your kidney disease and slow down damage to your kidneys. It does this by preventing certain minerals from building up in your body, which is important because your kidneys do not work as well to remove waste products from your body. Being physically fit is good under many circumstances, and studies have shown that patients with CKD participate in physical activity 9 days a month, and 45% of patients with end-stage kidney disease reported not exercising at all. This is not a good thing because individuals with higher physical activity have shown to have a 53% lower risk of death compared with those that are less physically fit.
Chronic kidney disease is one of the leading causes of death worldwide. It affects over 10% of the global population, which is more than 800 million people. It most commonly affects older individuals, women, racial and ethnic minorities, and individuals who suffer from diabetes and high blood pressure. Risk factors for chronic kidney disease include having diabetes or high blood pressure, heart disease, obesity, having a family history of chronic kidney disease, prior kidney damage, and old age. So some ways to manage chronic kidney disease are maintain a healthy blood pressure. For most people, they should aim to keep their blood pressure under 140/90. They can eat a healthy diet to maintain healthy blood glucose levels. They can implement physical activities. Adults should aim to get 150 minutes of moderate physical activity per week. This will also help them maintain a healthy weight. A healthy BMI is between 18.5 and 24.9. They should also try to get 7 to 8 hours of sleep each night. And if they are a smoker, they should try to quit smoking.
Steps for treating chronic kidney disease. Starting off, treatment measures consist of helping control signs and symptoms, reduce complications, and slow progression of the disease. Then, when it comes to treating the cause, depending on the cause, treatments options may vary. Some treatments depending on the cause may include high blood pressure medications, medication to relieve swelling, medications to treat anemia, and meds to lower cholesterol levels. And a lower protein diet to minimize waste products in your blood helps as well. For treating end-stage kidney disease, some examples are dialysis and kidney transplants.
To help Jeff better prevent his chronic kidney disease from progressing, Jeff's doctors could have used motivational engineering to encourage Jeff by speaking with Jeff about what he felt like he could specifically change in his life to incorporate new healthy habits. Uh, this includes helping Jeff identify barriers and issues and identifying reasoning for his goals.
After identifying what Jeff's goals and motivations are, Jeff's doctors need to reaffirm these motivations to Jeff using open-ended questions, affirmations, and reflections. After interviewing Jeff and evoking motivation, Jeff's doctors can help him come up with a plan and set realistic goals to provide lasting change.
Jeff's doctors can use the social cognitive model to process his cognitive, behavioristic, environmental, and emotional models of behavior change so that they can provide counseling interventions in order to prevent his chronic kidney disease. They can also use Fogg's behavior model to help Jeff implement easy to do behaviors that don't require a lot of motivation but can be easily triggered.
And then here are our references.